Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Today I wanted to talk to everybody about elbow pain and a couple of specific reasons why it can happen. So before I went to grad school and got my doctorate degree, I was a fly fishing guide in South America and Alaska for about a decade. So I spent 8 months out of the year in Patagonia, Chile, and 4 months out of the year in Alaska, and I did that for about 10 years before I went back to school. And another thing that I really love to do is play golf. So golf and fly fishing are two sports, along with a bunch of other things, that can cause a lot of elbow pain, and it's two of the reasons why a lot of people that like to do those two things end up having to stop doing them, because they get either pain on one side or both sides of the elbow and they can't play anymore or they can't fish anymore, and neither one of those things is good, right? So fly fishing and golf are relatively similar in, when you're casting a fly fishing rod, you're going back and forth with your arm like that, so you're using both medial and lateral epicondylar muscles, and with a golf swing you're doing the same thing, right? So one of my pet peeves is when they call it golf or tennis elbow, because it could be on either side for either of those sports, depending on what hand you are or how you play or just how your body works. So medial and lateral epicondylitis with golf or fly fishing, very common problem. So as far as both medial and lateral epicondylitis goes, I think one of the primary reasons that it's such a recurrent problem is you have all these big muscles that are coming up like my fingers, right, and attaching on the medial epicondyle and attaching on the lateral epicondyle. And the epicondyles are very small. They're like the size of your fingertip, right? So you get all these big muscles that are crossing the wrist, crossing the elbow, and on the elbow side they're attaching on a very, very small point, so you get a lot of stressful tension on that bony prominence there when you get aggravated in short muscles. So just think about every little knot you get in your muscles. If you just think about all of these muscles like pieces of string, every time you tie a knot in a rope, it gets shorter. So every time your muscles get little knots in them, they get shorter. And every time they get shorter, they pull more on that little piece of bone and the periosteum, where the muscles and the tendons attach, right? So remember, the tendons attach to periosteum. Periosteum is like the vascular lining or the casing of a bone, right? So the epimysium is the muscle lining, the periosteum is the bone lining, and the periosteum gets inflamed. So if anybody has gotten whacked in the shin by a hockey puck or anything like that, bone bruises are really, really uncomfortable and they take forever to heal. And the reason they take a long time to heal is when the periosteum gets aggravated and inflamed, because the muscles that are attaching there are always contracting and relaxing to some degree or other. You get constant stress in the periosteum, so you just get like this residual inflammation of the periosteum, this residual periostealitis, and that is what, in my opinion, causes recurrence and of the pain in the elbow, right? It's what causes recurrence of the condition and makes it chronic. So if you're treating the body anywhere without needles, it's impossible to directly treat the periosteum. If anything in the body is impossible to treat directly but the skin, unless you're using needles, right? Because you have to go indirectly through the skin if you're just using your hands. With needles, you can directly touch this stuff. So especially if you add in low frequency electrical microcurrent, so low frequency is typically considered 1 to 5 hertz. That's been shown to be the best at reducing sympathetic hyperactivity, which is something that's a big problem when you get pain anywhere in your body. It's also been shown to significantly reduce joint inflammation and edema, right? So low frequency electrical needling through the periosteum, crossing the elbow joint, very, very helpful at reducing a problem that typically takes quite a while to fix, right? Epicondylitis takes a long time, chronic problem. Like a lot of chronic problems, plantar fasciitis, headaches, they become really, really easy and quickly treatable when you're using needling, because one of the primary things I think in those conditions specifically is you can directly treat the periosteum and remove the periostealitis, remove the inflammation of the periosteum. Also, by regulating the autonomic nervous system, depressing sympathetics, elevating parasympathetics, that also reduces body-wide inflammatory markers like interleukin 1, interleukin 6, tumor necrosis factor alpha. Needling also turns on an intracellular anti-inflammatory pathway that works with the mitochondria, helps with DNA. It's called the NRF2 pathway, right? So that's an anti-inflammatory intracellular pathway. So needling, aside from specifically treating the structures, is also regulating the autonomic nervous system towards homeostasis. So aside from just treating the elbow and the muscles that cross, the arm and the shoulder, you want to also focus on treating the parasympathetic nervous system itself, because that is one of the best ways to reduce sympathetic hyperactivity and induce autonomic homeostasis and healing, right? So don't forget to needle the auricular branch of the vagus nerve in the ear, upper cervical spine, C2 spinous process, sacral plexus, right? Pelvic floor. Pelvic floor is innervated by the sacral plexus. Very, very good place to reduce sympathetic hyperactivity. So again, remember, the overall thought process of treating any impairment should not be to treat the specific impairment. So although obviously you're going to want to treat the elbow in this instance, you need to make sure, or I think the proper way to think about it is think about treating the nervous system itself, right? So if you're treating the autonomic nervous system, you're always going to be led to treating the area of primary complaint, because that's obviously necessary to reduce sympathetic stress and induce autonomic nervous system homeostasis. But if you think about treating the nervous system itself, so in general, all of our patients or anybody in pain are going to be in sympathetic hyperactivity. So if you think about removing as much pathologic tissue from all over the body, every little piece of pathologic tissue is going to elevate sympathetics, right? So don't just treat the elbow, make sure you treat the pelvic floor, the legs, all that stuff. Every little bit of tissue you normalize is going to normalize the nervous system and allow the body and the brain to take care of themselves better, right? Also, obviously, if you're treating the nervous system, you're going to be led to the primary area of complaint, which would be the elbow, and then it forces you to think about the body as a whole rather than getting, tunnel vision and just looking at the elbow. And then along with that, with all of our treatments, we should be directly targeting the parasympathetics, right? So needling all these structures, very, very quick fix for the elbow on both sides, medial and lateral. And then another very, very important thing that a lot of people forget about or they don't know how to do as far as elbow treatments goes is the radial head, right? The radial head right there. If my fist is the radial head, as you supinate and pronate your hand or your wrist, the radial head rotates and has about 270 degrees of contact with the ulna there, right? So the radial head is circular. It's like if this is the radius, this would be the radial head. It's very circular. So as it rotates around, 270 out of the 360 degrees of the circle contact the ulna. So if that joint moves a lot, even though it doesn't seem like it would, it rotates around an axis a long way. So if the radial head has been stuck, which it gets stuck and displaced when you have tight muscles there, that needs to be manipulated back to neutral after you needle, or else the deviation of the radial head itself is going to lead to recurrence of the problem. So we can reduce the inflammation of the periosteum with needles. We can also reduce inflammation of periosteum by reducing joints back to neutral so they won't be stressing the joint capsule, which also attaches to the periosteum right there, right? So elbow manipulation included with cervical manipulation and full spine manipulation, any deviated joint. Again, remember, the elbow is innervated by the brachial plexus in the neck. If any part of the spine gets deviated, C1-2 is the most mobile part of the spine. That's the easiest joint of the spine to self-correct. If C1-2 get thrown off, the scalenes, which attach to the transverse processes, the anterior and the middle scalene attaches to C2. That's going to get aggravated. The middle scalene is going to get tight. It's going to pull the first rib up. That's going to cause you more elbow problems and thoracic outlet syndrome type problems, right? So needle the elbow, address the parasympathetic nervous system, address the entire body, make sure you get needles on the periosteum, and include manipulation into your treatment after the needling. You guys will have really, really fast and good success. If you're a regular person with these problems and you're looking for treatment, get a hold of us. We can direct you towards somebody that we have trained, or if you're a practitioner and would like to learn how to do this stuff, get a hold of me, email me, or call me, and we'll get you set up for a class. Thanks, everyone.